BSN-366. I'm going to be doing a blood transfusion video. I am in uniform gray top as well as my blue uniform pants. Right now I do not have an IV pole, so right now what is going to be my IV pole is my vacuum cleaner. I had to improvise because this is all I had. I have my normal saline right here. I have my blood type O right here. I also have my white tubing. It has everything I need. Everything is working on here. It has the clamp right here. I'm going to close the clamp so when I go to prime the tubing and things like that, okay? So I do want to show you that I have everything that I need. Also, before I open up all my supplies, of course, I'm going to wash my hands, put on clean gloves, open up all my equipment, okay? I did identify the patient using 2 identifiers, which is their ID band as well as their birthday, or their ID band and medical record number. It just depends on what the facility requires. As long as it's 2 identifiers, I have my signed consent already. I have my requisition form. I have I verified the compatibility and make sure that it is the right blood that I'm going to be giving to the patient. I verified with another nurse. I verified the label on the blood transfusion bag as well as the client's name, the expiration date, the identification number, blood type, RH group, as well as the blood donor number, okay? So, and the expiration date, I'm not sure if I said that. So I identified all this and I checked it with another nurse as well, okay? So after this, I'm going to begin the process, but I wanted to let you guys know what I did prior. Okay, I washed my hands. So my hands are clean right now. I applied clean gloves. All the clamps on this is closed. As you can see, everything is closed, okay? Even this clamp right here as well is closed. So what I'm going to do right now is I'm going to spike the normal saline bag, okay? And remember that the bag is 39 inches above the patient, okay? As you can see, it's spiked and it's secure. And now I'm just going to undo this right here so it can flow right now. And I'm just going to squeeze. So when I do the normal saline, I'm going to make sure that I fill it about where it's going to pass the filter just a little bit right here, because you don't want the blood to hit the filter or something and hemolyze, okay? So that's the reason why we're going to just have the normal saline go a little bit past the filter, okay? So I did want to let you guys know that. And then you just tap it just to remove any bubbles, okay? After I do that, what I'm going to do right now is prime the IV tubing, okay? And the way that I prime it is I'm just going to unclamp the clamp that goes to both of them, right? The one that goes to the blood as well as the normal saline. I'm going to unclap it and I'm just going to lightly open this a little bit, making sure that I stay conscious of infection control. And then I'm just going to let the water kind of drip down so it can prime the tubing, okay? So I'm going to do that now. I'm going to pretend like I'm dripping it into something, okay? So I'm going to do that right now. And as you can see, I'm sorry, I'm working with not that much. And you can see that it's dripping right here inside of the trash can. Let the tubing go down and let the normal saline go down so I can make sure that it's primed and there's no bubbles. And as you can see, I'm going to just take it off just for video purposes to let you guys see that it's primed. See how it's falling? I'm just taking it off for that purpose. So now my tubing is primed. Okay, so you're just going to agitate the bag a little bit to make sure that all the cells and plasma is mixed together, okay? You are not going to shake it. You're only going to just agitate it a little bit, okay? Okay, just for video purposes, I do want to let you guys see that after I primed the normal saline through the tubing, I did close the clamp back that's on the common tubing, as well as all these clamps too are closed as well. So all 3 clamps are closed. I just wanted to make sure that I set that. Okay, now that everything, of course I told you that everything was clamped. Of course the sterile cap is still on place after the tubing was primed. Now what I'm going to do right here, and remember the normal saline clamp is locked as well, so the blood So when I spike the blood bag, it won't flow into the normal saline size. So what I'm going to do is, remember, my hands are clean. Infection control is a must. Of course, I did double check again the compatibility. So I'm going to release this, spike the blood bag. The blood bag is spiked. I'm going to release the chamber on the blood, and then I'm going to squeeze it. Remember, this side is still closed. I'm going to squeeze it and let the blood drip in. As you can see that the blood went through, and then the transfusion, the blood is starting to go down the tubing because I did unlock this one. So you can see that it's starting. Also, once the transfusion starts, we want to stay with the patient for the first 15 minutes. We want to check vital signs at 5 minutes as well as 15 minutes after the transfusion starts. We're going to assess the patient for any type of reaction. If there is a reaction such as chills, nausea, a rash, vomiting, tachycardia, anything like that, we're going to stop the transfusion immediately, okay? Because that means that they're having some type of adverse reaction to the transfusion. Yes, and then we'll, of course, make sure that we monitor the patient. Thank you so much.